All right, from mommy duties to the science lab, how two Bay Area moms are changing healthcare one gut at a time.
8:47 here during this Asian American Pacific Islander Heritage Month and beyond. One doctor is blending Western science with holistic care to help people feel and be better. We're so happy to welcome Dr. Elisa Song to Mornings on 2. Thanks so much for being with us.
Oh, thank you so much.
Before we get to this display and what's happening in our tummies, a lot of people think it's either Western or holistic care. Not the case.
Yeah, that is such a good question. I used to call myself a holistic pediatrician, and in reality, as pediatricians, we all should be holistic, taking this child in front of us in the context of their home and their family and their community. So I now call myself an integrative pediatrician. So I was trained at UCSF, very conventionally trained, and I also incorporate nutrition, functional medicine, herbal medicine, acupuncture, essential oils. There is a time and a place for just about anything, and we really want to take the best of all worlds, knowing that conventional medicine has saved lives, but there are limitations and there are unintended adverse consequences. So we can take this whole kind of root cause holistic approach to help our kids thrive.
And you also work really hard to get more people what's called culturally competent care. So many people, look, I'm in a paper gown, I'm in the doctor's office, I'm already nervous about what she's going to say. People need to feel free and easy to communicate.
That's absolutely right. Well, I am an AAPI mom. It is AAPI Heritage Month. And as an AAPI mom and pediatrician, I'm so honored to be a part of the San Francisco Bay Area community, which is really home to one of the largest AAPI communities in the country. And I just love, with my partner Cheryl Sew Hoy, who's also an AAPI mom and founder, we're going to be talking about tiny health, that we can show our kids that we can be leaders and doctors and entrepreneurs and really get out there and make a change in the world.
I like it. All right, let's talk about this display because I know people have questions. We're talking about gut health, right? Hopefully by now most of us know gut health helped by a balanced diet, lots of fiber, fruits, veggies, fermented foods, sauerkraut, kimchi. Adults know that, but how do we spread that message of gut health importance across all ages?
So important. So I am Chief Medical Officer of Tiny Health. Tiny Health is the gold standard in microbiome testing for babies, kids, and adults. And if there's one message that I can get out to moms, we're right on the cusp of Mother's Day, is that all health starts in the gut. When we're trying to optimize your child's brain health or immune health or future health, we need to look at their microbiome. And Cheryl founded Tiny Health when her baby developed eczema and food allergies. And she didn't have any answers. It's so frustrating to not have answers, right? And there were no pediatric-specific microbiome tests to help guide her. So she found a solution. And this solution has served not just her family, but my patients and families everywhere.
Even though you and I, we have children of similar ages, kind of young teenagers, we're out of the changing diapers years. Thank goodness. However, when you are in those infant years, parents know exactly what's going into and coming out of a baby. Once they grow up and they become too old to talk about what they do in the bathroom, a lot of parents are cut off from what might be real problems in their child's gut.
Yeah, this is really important. I'm going to also highlight that May is Mental Health Awareness Month. And we need to be aware of this because our kids and our teenagers, we have teenagers, are in a state of mental health crisis. And what we need to understand is that brain health starts in the gut. In fact, 90% of our neurotransmitter serotonin, which helps us feel calm and relaxed and manage stress, is made by our gut. So when we can have actionable steps, like a simple at-home test, I teach my kids how to create microbiome magic, I mean, all the things. If we start with the gut, this new way of looking at gut-brain health is really changing the way we think about pediatric mental health.
In the 2 minutes, the 2 seconds, I wish we had really 2 hours, but in the 2 seconds we have left, is a gut health test like this something a patient would ask a doctor for or something they do on their own?
They do on their own with Tiny Health, and literally you get this kit, you order it yourself, and it's literally one little swab. Super easy.
It's not as gross as you think, right? All right, we'll have to leave it here. I appreciate your time and your efforts and the fact that you're helping more people feel better because that's what it's all about.
Yes, thank you so much for having me.
Of course, Dr. Song, thank you. Andre?
All right, the San Mateo County Board